South Dakota. It's experiencing record cases, deaths, and hospital levels. The positivity rate there is the highest in the nation at almost 60%. The state has taken a hands-off approach to public health protocols recommended by the CDC. Back in July, President Trump hosted an Independence Day celebration, as you can see on your screen. This was in a packed amphitheater at Mount Rushmore. A month later, nearly 500,000 bikers flooded into the town of Sturgis for an annual motorcycle rally. South Dakota's Republican Governor Kristi Noem supported both events and refuses to issue public safety directives such as wearing masks. Here's what she said a couple of weeks ago at a Trump rally.
The only reason you know who I am today is because the liberals have been busy kicking me in the head for all the decisions I've made for my people in South Dakota. But let me tell you, my people are happy. They're happy because they're free.
But here to describe what she's seeing on the front lines in South Dakota is Jody Doring. She's a registered nurse who has called the coronavirus crisis in her state, quote, a horror movie that never ends. Nurse Doring, thank you so much for being here. When I read some of your tweets, my jaw dropped. You said that even now that the hospital is being overrun with COVID patients. They come in, they're horribly ill, they're gasping for breath, and yet they don't believe they have COVID?
Yeah, I think the hardest thing to watch is that people are still looking for something else and they want a magic answer and they don't want to believe that COVID is real. And the reason I tweeted what I did is it wasn't one particular patient, it's just a culmination of so many people. And their last dying words are, this can't be happening, it's not real. And when they should be spending time FaceTiming their families, they're filled with anger and hatred. And it just made me really sad the other night. And I just can't believe that those are going to be their last thoughts and words.
Anger and hatred towards you?
I think it's just a belief that it's not real, and nursing happens to be on the receiving end of that. And that's okay. We can take that. That's what you're there for. It's just in the bigger picture when you try to reason with people of, can I call your family, your kids, your wife, your friend, your brother? And they say no, because I'm going to be fine. And you're watching their oxygen levels, maxed out on what we call vapotherm at 100%, and their oxygen level might be 75. That's not really that compatible with life. And we know where that's going to head. And it just makes you sad and mad and frustrated. And then you know that you're just going to come back and do it all over again.
They're gasping for breath. Their oxygen levels are dropping. What do they think is wrong with them?
I think people look for anything. People want it to be influenza. They want it to be pneumonia. They want it to be, we've even had people say, well, I think maybe it might be lung cancer. Something so far-fetched. And the reality is, since day one, when COVID started in this area in March, you've kind of been able to say, if it walks like a duck and talks like a duck, it's a duck. Like, I hate to tell you that you have COVID, but that's what you have. Even after positive results come back, some people just don't believe it.
So mind-blowing to think that they would rather have lung cancer. They'd rather a diagnosis of lung cancer than of coronavirus.
Our entire state has 880,000 people. It doesn't take much to do the math on that for how many of us are sick.
Oh my gosh. When you hear your governor, Kristi Noem, say, my people are happy, they're happy because they're free, what's your response?
I think it's frustrating as a healthcare provider because the last thing that we ask anyone when they seek care is how they voted or if they're a Democrat or Republican. The last thing we ever think about is that. What we think about is, how can I help you? And so anybody that uses any chance to make this political makes any healthcare provider want to scream, because at the end of the day, we just want to help. And if we don't get some help from the public as far as mask wearing and social distancing, there's a thing on the internet right now that says, I'm not your first line of defense, I'm your last.
So I understand, Nurse Doring, you have more deaths than you have people in your town.
Yeah, in the state of South Dakota, I haven't looked in the last few hours. I think we had 683. Don't quote me on that. But the town I live in has 650 people. So when you put in perspective, and people listen to me talk about this for the last 9 months, that's every single person in our town gone.